right now Medtronic doesn't necessarily have a very good track record of following up with, say, like warranty recalls on their products. You know, they don't end up paying for the surgery to replace the product. You're talking about implanting a lot of new chips, and I'm curious to see how you're actually going to address the relevant chronic conditions, not just heart stuff necessarily, but you know, diabetes and what have you. And if you're actually going to guarantee your products and pay for the doctor to replace them, or are you just going to foot the bill to Medicare?
You're lucky you're not presenting after us. So in my head, I'm trying to think of something beyond quality control. I can't quote you exact statistics on how many products are actually returned, but we are still number one in the vast majority of areas in terms of implantable devices. We wouldn't be there if quality control was considerably worse than our competitors.
You're in a very competitive environment where you have some installed bases, and if you're doing an R&D, a product development cycle in 1 year turnaround is
unrealistic.
Well, I mean, is it realistic is the question. So.
It's not that you're developing a whole new device in just a span of a year. One of the things that we already have is devices that are being used. So be the market leader, stay there, and just sort of make them into the wireless space as well. On the other hand, like you said, yes, there's a lot of R&D required to make new products. And depending on this, as the market comes on along and there's different conditions and different areas that open up in wireless health, I'm sure we'll be sort of using our own R&D as well as having strategic partnerships with others as well to develop new products within the space.
What will you do if GE is successful in having its proprietary standards become the most popular way to communicate and perhaps ordered by all hospitals? Will that shut you out or shut your patients out and force your doctors to use other implantable devices?
If they do become the go-to system and they have a good hand of that, but they're still not providing or manufacturing those devices that will be used. So it will be a good collaboration that we would have with GE and the hospital systems. So GE provides a lot of the back-end services once the device has been used, once the device has been implanted, and it will be a collaborated partnership like we were saying. So it's, with this space opening up, it's very difficult for one company to just hold and do everything. And that's where we come in with our partnerships, and we'll work with them to make sure that both them and us are leaders in our spaces.
I'm wondering if you had more time, would you start negotiating and talk with other teams? Or was it a matter of time or not a matter of time, but you felt you didn't really need them to make this work?
To be honest, we did not want to tie ourselves down to one particular partner. We wanted to provide a standard which can be used by multiple people, and then go ahead and we want to position ourselves as the providers of the data, and then they can go ahead and analyze it however they want.
But sometimes standards are established by groups of companies and industries. Usually it's very hard for a company to create the standard in their minds, and then in reality it takes effect in the market. So just a thought.
We don't want to develop the architecture or the means of from getting the data from the device to the physician. Like, if GE's system is the dominant is the dominant way of doing that, then we'd want to work with GE to make it happen so that our data can be read. They wouldn't want to shut us out either, though, because if you have a system that can't read Medtronic devices, then that's something that clinicians would be very concerned about.
Okay,
so.
fair enough.
In our research, the one thing that I think you guys need to be commended for is just your high kind of moral commitment and how that's tied to the business. And based on what we found in our research, we found that during recalls and just your relationship with patients and how you're actually a face to a lot of the patients that have devices made by you. Oftentimes, you guys will actually be like proactive in terms of your recall strategy and just kind of going to doctors and saying, look, we found this potentially hazardous issue. We'd like to just bring it back. And a lot of times it's doctors who are like, no, it's technologically fine. We're okay with it. Thanks for bringing it to our attention. So I think you raise a good point in terms of the overall cost of doing so, but just wanted to highlight that that actually happens a lot in parallel.
They did have that, and what they did was they built a lot on their customer service segment. Yeah. So they did realize where they were losing out, and they actually took great efforts to make sure that they negate that effect. So.
We do.
We.
Yeah. We. Okay. Thank you very much. Thank you.